Good morning. I'm Cindy Larsen, President of the Muskegon Lakeshore Chamber, and I want to welcome everybody for joining us today. Many of you joined us in March when we held a previous discussion with local healthcare leaders, and they told us about how our area was preparing for the arrival of COVID-19. At this time, the focus is on preparing for COVID-19, and now our medical community is continuing to deal with it and with a number of patients. A lot of people, though, are starting to focus on how to return back to work safely. So today we brought back the leadership from Mercy Health and Region 6 Healthcare Coalition to update us on the situation as it stands now and to help share some best practices so that we have some more direction on things that we can all do to help Michigan get back to work. We invite you to listen to these updates, and we've also already received questions online prior to the show, and we're going to answer those in a few minutes. We're asking those of you listening to please mute your microphones right now, and we want you to know that there are a number of media organizations that are listening in as well. So now it's time for me to welcome Gary Allore, President of Mercy Health Muskegon. In March, Gary told us how Mercy is prepared for the arrival of COVID-19 and the surge that could come with it. Today, Gary is going to update us on where we stand now. Gary?
Thanks, Cindy, and thank you for hosting this again for another update. And we just appreciate what you guys do for this community, especially the business community. So thank you for doing this, and thanks to our business community for joining us this morning. This week happens to be National Healthcare and Nurses Week, so I want to first thank the heroes that you see at Mercy Health in Muskegon every day, but our nurses, our physicians, our frontline colleagues that have safely been taking care of this community over the last 6 weeks as we've been kind of working through this COVID pandemic. So thank you for our colleagues, and also thank you to the community. As Cindy mentioned, 4 or 5 weeks ago when we did our last update, it was we were preparing for what could be a pretty significant surge. And I just want to thank the community for the safe choices you've been making. And it's definitely had an impact on what we've been seeing in our organization. So as we talked about last time, we were planning and had ramped up for 80 beds worth of easy capacity with our new medical center. At this point in time, we've actually only had to use anywhere from 10 to 20 beds on the 6th floor of the Mercy campus. So our volumes, and we did not see a significant surge. So we've seen some pretty steady volume, but not significant. When we were modeling a few weeks back, we were looking at the potential to have in the hundreds of patients, and we're prepared for that. But we haven't seen that, and now we're really looking to look to the next phase and look to how we're going to ramp up for we'll try to get back to somewhat normal times. Just a little base of information from an organizational perspective. As we were ramping up for the potential surge for COVID, we had actually stopped all elective kinds of surgery, not emergent surgeries, and some of the normal day-to-day kinds of cases that happen in our organization we had stopped doing, and to prepare for the space that we thought we may need for the ramp up. At this point, as I mentioned, we haven't seen that. Just as a piece of information, so for the month of April, we normally have a daily census of about 150 to 160. I'm sorry, that's what our census was in April. Our normal census is in the 230 to 240 range. Our census in April was in the 150 to 160 range all month. So significantly lower because we were preparing and not doing a lot of inpatient surgeries. From a surgery volume, we usually do about 1,600 cases a month in surgery. For the month of April, we did about 400 cases. So only emergent kinds of cases were coming through our organization. And then from an emergency room perspective, this is an interesting one. People were definitely staying home. We usually do about 9,000 emergency room visits a month, and we only saw about 5,000 in the month of April. So I think we did a good job, an appropriate job in this community at staying home and staying out of the healthcare system. But now as we look out for the next few weeks and months, and we've got way better modeling information using our actual baseline of information over the last 6 weeks, we believe that where we are today, we're going to continue to have a COVID population in our organization, but we feel like we're going to be anywhere from 10 to 25 patients for until there's a vaccine, we're going to see a small, consistent volume of COVID patients in our organization, and we feel like we very much stabilized and are ready to handle that. So, so as we're doing that, we are also starting to think about ramping back up. And last week, we actually did start to see some of those time-sensitive kinds of procedures that we had been holding off on for the last 6 weeks. We are now starting to do that. And we definitely want to make sure that our community knows that we want them to access our system. We want to make sure that we're not putting off time-sensitive procedures that need to happen. So our healthcare system is ready and safe. We, because we never saw a huge surge, we're in a very good place from a PPE perspective. So we've got the supplies we need. We actually have very readily accessible testing supplies, so we can get tests quickly, turn those around for patients before they would have their surgery or procedure. We feel like we're in really good shape to begin to ramp up. As I mentioned, we started to do that last week, and over the next 2 to 4 weeks, we're going to really start to do some of those cases that we've been putting off. So we expect to see that, and we just want the community to know that we are prepared. We're very safe. We have 200 beds that are available to us because our volumes have been down on purpose. We have the ability to handle the volume that will come back into our system. So we just want to encourage the community to begin to think about ramping cases back up that they've been putting off, and we're available and ready. The last thing that we'll probably do an update maybe later in the summer, but I have had a lot of questions about our medical center, and we are still on pace to move our Hackley patients into our new medical center this fall. So we are still planning for that, but I'll do an update at a future time. Certainly having both the Hackley and the Mercy campus during this COVID-19 situation has been a really positive thing for this community. So I will now turn it over to Kathy Moore.
Thank you, Gary, and thank you all for joining us. Just a brief update on the Muskegon County stats. As of yesterday, May 4th, we have recorded 317 confirmed COVID-19 cases, 18 related deaths, and we have estimated that 48 of these individuals have recovered at this time, and we project by this time next week, 95 of those individuals will be recovered. A few statistics of the 317, 126 of the positive cases are male, or 40%, 191 or 60% are female. The age group most impacted, ages 50 through 59, has 21% of the cases, and the next age group, 20 through 29, 18% of the cases. Racially, we are seeing a high prevalence of positive cases among Black residents at 43%, when they make up just 14% of our population. And 31% of the cases are classified as white. We also have a group of unclassified because we haven't been able to reach those individuals yet. So at this time, I do feel that we have this under control. We have a great community, a great response team. We are tracking the cases. We are contacting the close contacts and putting them in quarantine. We're isolating the positives. So I'd like to thank the community for their role these past few weeks in staying home when asked, and wearing a face covering or maintaining your social distance when leaving the home. I'd also like to thank the businesses that have remained open. They have all taken precautionary steps to keep their workers safe. As more and more businesses start to come back online, we ask that you assess your work environment for potential exposure risk, and then take the necessary steps to keep your employees and your patrons safe. Those steps would include, once you assess your business, see if they can maintain that 6 feet social distancing, provide face coverings if needed, clean and disinfect high touch surfaces. With that, I'd like to introduce Dr. Jerry Evans, the medical director from the Region 6 Healthcare Coalition, to talk about the COVID-19 from a regional perspective.
Thank you, Kathy. I appreciate that very much. And thank you to all our business leaders for being a part of this. And thank you to our healthcare systems for all the things that they've done, and to our health departments. As Kathy said, I'm the medical director for Region 6 Healthcare Coalition. The state of Michigan has been divided up into 8 regions, and we've been doing this disaster preparedness for, since 2002. And in those regions, these are all funded through special grants through the federal government and through Michigan Department of Health and Human Services. The purpose of the regions is to prepare healthcare entities for disasters. Region 6 is made up of 13 counties in West Michigan, including Clare, Ionia, Isabella, Kent, Lake, Mason, Mecosta, Montcalm, Muskegon, Newaygo, Oceana, Osceola, and Ottawa. We have about 1.4 million people in our region. And in that region, we have 22 acute care hospitals with emergency rooms, 2 freestanding EDs, 2 psychiatric facilities, 63 nursing homes, and a large number of adult foster care homes, dialysis centers, urgent care centers, home care agencies, and a number of other healthcare entities. We try to help all of those entities as much as we can in preparing for disasters and also in responding to disasters. So in this case, we've been receiving a lot of material through this strategic national stockpile, to include masks, gowns, gloves, face shields. We have received cots from the strategic national stockpile. We had some things already in storage and ready to be distributed, but we've received a lot more of that material over time. I just wanted to cover a few statistics for our region as far as what's been going on. In our region, we have about 2,319 hospital beds available at any given time, or that are in our hospitals, in our acute care hospitals. Of those, about 411 are ICU beds. Currently, we're not seeing a huge volume of patients. And currently, as of yesterday, there were 936 of those beds that were still open and available, and 165 of our ICU beds were still available. We had 366 ventilators available if we needed them. So those are good numbers. That's good that we have those available in case we need them. Right now, we're not seeing a tremendous number of COVID patients. In our region, in our 22 acute care hospitals, we have about 80 patients in med-surg and 52 in ICUs throughout our region. And that's as of yesterday. Obviously, in the Detroit area, they're seeing a lot more patients, and they're seeing a lot more volume in their hospitals, but even that's getting better over time, and that's good to hear. Through our regional coalitions, we've been tracking this information throughout the entire state of Michigan, including all of our different counties, and we've been able to see the improvement in the Detroit area quite substantially over the last probably 2 to 3 weeks. The numbers have been dropping, and that's been a good thing to see. One of the things we did as the regions, we also helped set up the acute care sites, alternate care sites rather. We've sent them up in Kent and Muskegon counties, and we've had beds that we've been able to distribute out to them. We had about 300 beds in our stockpile at the time, and so we put those out, but the federal government has sent us 600 additional beds if we need them for the future. So that's a good thing. We have been able to get those. We also have had a number of deliveries of masks, N95 masks, gloves, and we're okay with those things. The biggest need right now is hospital gowns and isolation gowns. That's shortage all over the country. We certainly are feeling that in Muskegon and in the West Michigan area. So I think that one of the great things that has happened is our nursing homes have really responded well to this as well. We do have COVID positive patients in nursing homes, but they've really worked hard to isolate those patients. And in fact, some of our nursing homes have actually established wings in their homes that are taking care of COVID positive patients. That's been a big help to our hospitals too, because we can send patients who don't need to be in the hospital, but can be in a nursing home. Our nursing homes have really responded well to keeping patients there. Our health departments have done a lot of testing, or working with our nursing homes to do a lot of testing now in a lot of different areas, and that's been really good to see as well. We'd love to increase testing as things become more available, and I think that is happening now. We're seeing a more availability of testing capacity, both in hospitals and in our regional labs, and that's great to see. I think one of the biggest things from our regional standpoint, as we begin to open businesses and open stores and other things and services throughout the area, is just understanding how this disease is transmitted. And certainly masks are a part of that. We strongly encourage people to wear masks as needed. But the biggest thing, I think, is really hand washing as well. And I really encourage people to focus on that. If you have a mask on but you're touching your face all the time and readjusting your mask all the time, that's actually transmitting that disease more than it would have otherwise. So the biggest issue is really hand washing, hand sanitizer, utilizing that as much as possible, and being aware of what you do with your hands. And that's a key part of that, and cleaning those high touch surfaces, as Kathy said. So those are the things that we would encourage people to do as you open your businesses, as get back to work. And we appreciate all the things that our community has done, all the ways that so many people have cooperated and helped out. It's been a real great thing to see as a region, seeing that all throughout our region, both in the rural areas as well as in the urban areas. And people have really worked together and pulled together in this. So now I'd like to introduce Dr. Kristen Brown. She's the president of Mercy Health Physician Partners.
Thanks, Dr. Evans, and good morning to West Michigan. As Dr. Evans mentioned, I'm a president of Mercy Health Physician Partners, and for those of you that aren't aware of the distinction, that's our provider organization. So I employ about 800 providers that staff our 85 ambulatory sites and our 3 hospitals along West Michigan. So our sites range from all the way up north to Ludington, down the Lakeshore and over to Grand Rapids. And we employ about 2,000 colleagues to support the ambulatory services that we offer. This includes primary care practices, as well as a variety of specialty care practices like cardiovascular, cardiology, obstetrics, gynecology, geriatrics, just to name a few. And I'd like to take this time to remind people that we are open and we are available to the community to help with any healthcare needs. Like Gary mentioned, our visit demand dropped drastically as the COVID pandemic began. And of our almost 50 primary care sites, we dropped down to keeping about 15 open along West Michigan. And part of that was to make sure that we had a safe environment to bring patients into, that we had enough personal protective equipment, and also just to flex to the demand that we were seeing. However, every one of our sites, the phone lines are open and they're being managed. So for patients that have questions for their primary care physician or their specialty physician, we want to encourage you to call the office, and someone will be there to take your call. You can also reach your provider through the MyChart portal if you're signed into that. And if you're not, we'd really encourage you to access your MyChart portal. It's a great way to communicate with your provider during this time and anytime, really. We are also offering video visits. So we have the 15 sites that are open for primary care and urgent care. And some of these sites are dedicated for patients that have fever or infectious type symptoms. And then other sites are dedicated to patients without infectious symptoms. And we screen all patients when we're making the appointments and then when we bring them into the practice to make sure that we're not unintentionally exposing anybody to COVID infection. And then we're also following the droplet precautions with masks, hand washing, and appropriate personal protective equipment, and then additional cleaning of workstations and office exam rooms. But we really think it's important that there are a number of patients out there that have chronic disease that need ongoing care to prevent emergency events or even deaths in the homes for patients that are afraid to come in. We have safe places, and we want to reassure you about that. And it's also important for children to be coming in, especially those kids less than 2 that need their well child visits and immunizations. We certainly don't want to see an outbreak of other communicable diseases among our infants and children during this time. So again, that's where we have in-person care. And then additionally, we've been offering video visits, both in specialty care and primary care, to manage those conditions that don't need to be seen and addressed in person. And if on our website, which is mercyhealthphysicianpartners.com, there is a listing of the different ways that you can contact the offices. And if you're not currently a patient and you're looking for a primary care physician, we are still accepting new patients, and you can access us again through the website or phone calls. And I just want to again emphasize what Gary said and what I mentioned already, that it is safe to come in and see your doctor. And we'll ensure that you have a safe platform to do that, whether it's in person or via video. As mentioned earlier, there were some questions submitted virtually before we started, and so I'd like to take a quick minute to address those. And the first question is, what types of offices are open? And as I mentioned, we have primary care and specialty care. Our urgent care locations in the Muskegon and Lakeshore area are currently at Sherman and North Side. So the North Side is up on Holton Road, and the Sherman Urgent Care is on the East Sherman Avenue. We have our fever and infectious sites at our North Side practice at Sable Point up north, and we also have one in North Ottawa at Family Medicine Suite 301. And then our what we call our fine clinics, which is fever is not evident clinics, those are at West Shore Family Medicine on Mercy Drive. One of our other North Ottawa sites, Family Medicine Suite 103, and then up in Hart, Family Medicine, Whitehall Family Medicine, and Shelby Family Medicine. As of next week, May 11th, we'll be opening Norton Family Medicine as another one of our non-COVID sites. And then the following week, we'll be opening adult medicine specialists and West Olive, as well as 3 other sites in Grand Rapids. The other question that I had was, who can be seen and how? And as I mentioned, we'll see anybody right now, either virtually or in person. So I'd recommend that you call to see which option would be best for you at this time. And as I've already said, we are accepting new patients as well. And then the third question is, if I have an accident at home, where should I go to be treated? Our website at mercyhealth.com, Emergency and Urgent Care, is a great resource that lists the difference of when to go to the ER for more life-threatening situations and when to make use of an urgent care or even your primary care physician. So I encourage you to use that to differentiate. But again, up north, we have, from an urgent care standpoint, the Whitehall office in Sable Point, and then here in town, Sherman and Northside are open. And then the last question I had is, if I need a mammogram or a physical, can I book an appointment? So when the COVID pandemic started, we had canceled and deferred our truly elective visits that could be postponed, which included routine physical exams. I'll make the exception again and say that children under 2, that's more critical that they be seen in a timely manner. But as we start to open more of our fine clinics, and then we're on the path to reopening all of our primary care clinics and should have these fully open on or before July 1st, we'll be able to start scheduling routine physicals. We are offering annual wellness visits to our Medicare population, and those we're doing virtually. But again, if you have a chronic disease or a medical question at this time, we're open and available and ready to see you. So as we continue to move forward, we'll also be looking at how we re-engineer our clinical services and our delivery network to best meet the needs of our community. We recognize that the COVID pandemic is going to be ongoing for the better part of the next year, and that we'll need to be flexible and adaptable so that we can continue to provide a safe environment for patients to receive important and necessary care. So with that, I'll send it back to Cindy Larsen.
Thank you, Dr. Brown. Thank you so much for what you've added to this conversation. Thank you, everyone, for the updates and the important insight that you provided today. We do have a few more questions that have been submitted ahead of time. The first few are for Kathy Moore. Someone has said they had heard about the rapid tests for COVID testing being done in Detroit. What kind of tests are available in Muskegon County?
So we do not have the rapid test. The rapid test is still an exploratory process. We do not confirm or consider those, and depending on what you mean by rapid. So we don't consider those 5-minute turnaround or 15-minute turnaround as laboratory confirmed cases. The Mercy Health, though, has made amazing progress from when we first started this, a couple of months ago or 6 weeks ago. All of our test samples were being sent to the State Bureau of Laboratory, and they were trying to process tests from all across the state, and there was such a delay in getting results. Then Mercy contracted with a private lab in Grand Rapids. The results came back much sooner, and they also have the internal lab and testing, and results are coming back much faster. So we've seen results as soon as a few hours to 1-day turnover right here in Muskegon County. And again, available through your provider, but they're very quick. Gary, you can help talk a little bit about what's available at Mercy.
Yes, I sure can. So, the testing equipment we have in our lab locally, as Kathy mentioned, we had some issues with turnaround 6 weeks ago, but now all of our inpatients are getting tested, and the test of using the lab internally is turning around in about an hour. So we've got great testing, of which those we have limited kits, but we've got kits at least through May, and we continue to source resources there. The outsourced lab is the Next Gen lab in Grand Rapids, and they're a busy lab, but they are turning things around anywhere from 24 to 48 hours now. So we're in a pretty good position. We have unlimited testing from that perspective. So as cases are coming in for outpatient procedures, we're usually having them come in and have the test done a day or two before, so we have the results back before the surgery. So yeah, we are in a much better place. That's why we feel like we're ready to ramp back up, and we feel like we have stability from our COVID volume perspective.
Okay, thank you. This question, for the businesses that have been open, and I would say the ones that are now opening, what kind of COVID testing have they been doing? Should they be doing? And this is related to the businesses that have been doing daily temperature checks or questionnaires about symptoms. Kathy, can you explain what best practices would be in that area?
Yes, so the businesses that have remained open, they've done a wonderful job with what's classified by CDC as the symptomatic-based approach. So there's a time-based approach, a symptomatic-based approach, and these businesses are screening employees and patrons as they enter the building, checking for symptoms, asking them the questions related to the virus, and then they have a process. If they answer yes and are considered at risk, those individuals are not allowed to enter the building or expose others. And we've had really good cooperation and success with that approach.
Well, then related to that, Kathy, so an employee then, they do determine that they are symptomatic when they arrive. Now, what should the employer and employee do?
If an employee presents and he is symptomatic, he should be sent home immediately, not exposed to that area, and actually told to self-monitor. If his symptoms get worse, he should call his healthcare provider. If not, he may return to work if he has been fever-free for at least 72 hours and symptoms improving.
Okay, so now same scenario. They've learned that the employee does have or a COVID situation or is tested for it. What steps do they need to take with the other employees of that particular business or facility?
So first, the business should confirm the diagnosis. So there are a lot of well-meaning notifications, and sometimes there's some confusion between being a close contact and actually being a positive case. So the diagnosis should actually be confirmed first. Then the business should assess the environment to see if any other employees may have been exposed during the positive case infectious period. So this it's not, ever, it's just during that period. And it would be considered a close contact. And a close contact is defined as being within 6 feet of the positive case for a prolonged period of time. So at least 10 minutes or longer without any PPE. And PPE, depending on the business, could just be a face mask. They should notify other employees who may have been exposed to monitor for symptoms. If they identified any close contacts, then we would work with them to quarantine those individuals. Then they should also clean and disinfect the area of the positive case as well as any high-touch surfaces.
Okay, thank you, Kathy. Now we have a question for Gary. Do you expect a surge in Muskegon County, and if so, when?
Actually, so I mentioned it a little bit earlier, but because we have 6 weeks of actual data and we know some of the assumptions we were making a while ago wasn't taken into account the significant work that's happened in social distancing. So as we look at that now, look at our actual numbers, we're not expecting to see a surge. The surge in our modeling today, and it gets updated every day, shows a surge of like 22 to 23 patients. We've been kind of used to 10 to 20 anyway, so we are not projecting right now a significant surge. That certainly can change as we start to open the economy back up. You never know when we could potentially see a small surge, but at this point, we're not expecting to see a surge that's more significant than we can handle with the capacity we have. So, but I would say in the low to upper 20s would be a surge for Muskegon. We certainly also have the benefit of not having the density of population as some of these other big cities. So.
We have one last question that came up in the chat, and if the somebody here doesn't have the answer, it's something we will find out about at the chamber, because we do want to know who's leading the way with best practices in Muskegon County in terms of any organization, public or private. I don't know if anybody has a comment on that before we close. I guess that's something we're going to find out about. And I think hopefully, Kathy, we hope to work closely with your organization on this re-entry, for all of the businesses that are going to be starting to open, or actually
Absolutely.
the 7th, more will be open. So looking forward to that.
Absolutely, me too.
Okay, great. Anyway, that's it. That's all we have time for. And if anybody does have an additional question, we will get back to you with more answers, but we're up for today. I want to thank everybody for taking the time. Like I said, we will try to get back with you if we have any other questions. We'll get those posted on the chamber website. The chamber does have a resource page. Hopefully by now you all have looked at the chamber's resource page, because we do update it frequently. So thank you, everyone, and stay safe. Hope to see you all soon.